Hello, everyone. Welcome. While we wait for more people to enter this expo session, I would like to remind everyone that November is Epilepsy Awareness Month. This year, our campaign is focused on encouraging people impacted by epilepsy to speak about their experiences through the Silence the Stigma campaign. If you haven't already, please visit efmn.org to find more information. I would also like to remind everyone that we have open exhibitor meetings this Friday starting at 1 p.m. If you are interested in speaking one-to-one with organizations and companies that specialize in epilepsy care, treatment, and devices, please schedule an appointment at efmn.org or email admin@efmn.org. With that, I would like to thank you all for joining us for the Innovations in Epilepsy and Wellness Expo. I am Nikki Baker, the program director with the Epilepsy Foundation of Minnesota. Today, we welcome Dr. Julia Das to speak on an overview of emotional and behavioral health conditions often associated with living with epilepsy. To ask questions throughout the presentation, please do so through the Q&A button located on the bottom of your screen, and we'll go through those toward the end of the session. Before welcoming our speakers, I would like to happily introduce today's moderator, Dr. Douglas Heck. Dr. Heck is a clinical psychologist who has been providing care for people with epilepsy and their families for over 30 years. He remains a member of the Epilepsy Foundation's professional advisory board. He currently practices in Duluth, Minnesota, where he provides assessments and intervention for people with epilepsy, non-epileptic seizures, and related conditions. Welcome, Dr. Heck.
Thank you, Nikki. Just wondering if everything is working okay here. I wanted to just check and see if everything is working okay here. Okay. Thank you everyone for being here tonight. We're all very excited about the chance to be able to get together this evening. This is really a unique opportunity to be able to not only learn some information about mental health issues related to living with epilepsy, but it's also a chance to ask some questions that are particularly important to you or your family about the mental health issues related to living with epilepsy. This is a chance to also learn about the local resources or the resources that might be available in your community that might be able to assist you with whatever issues that you might be trying to address with regard to yourself or your family. We have some really good speakers tonight and panelists tonight. In a few minutes, we're going to be hearing Dr. Das speak about some information about epilepsy and living with epilepsy. And then we also have Kay King tonight from NAMI, who is a very experienced person in working with people with mental difficulties and mental disorders. And she also is very knowledgeable about local resources and ways that people can get assistance for issues that they're struggling with. So with that, I think what I'll do here is I will introduce Dr. Das. Dr. Julia Das is a pediatric psychologist in private practice. During the past 15 years, she has devoted her clinical and research career to working with children with epilepsy. their comorbid emotional and behavioral disorders, and to patients with non-epileptic seizures. She was a co-investigator and site coordinator of an Epilepsy Foundation-funded multi-site study on non-epileptic seizures. She is currently conducting a multidisciplinary intervention and prevention study of the psychiatric and psychological comorbidities in new onset youth with epilepsy. This is called the Pediatric New Onset Epilepsy Program. Dr. Doss and a fellow neuropsychologist spearheaded this program to comprehensively assess all pediatric patients that present to the Minnesota Epilepsy Group within the first 8 weeks of diagnosis of epilepsy. Dr. Doss frequently lectures for the local Epilepsy Foundation of Minnesota program and provides both education to parents and their children with epilepsy, as well as to practitioners within the community. She's involved in speaking at a national level on pediatric new onset epilepsy, as well as non-epileptic seizures. Since 2008, Dr. Doss has presented annually at the American Epilepsy Society meeting on these same topics and is a member of both the American Epilepsy Society Non-Epileptic Seizure Task Force and the Psychosocial Comorbidity Committee. In addition to her 6 peer-reviewed papers and 4 chapters, she is a co-author of a guide for treatment of non-epileptic seizures in children. So it goes without speaking that we're very fortunate to have Dr. Doss with us tonight. I've worked with her for many years and have greatly appreciated all the time that I've had in working with her. She brings a tremendous amount of knowledge and expertise to our community. So with that, I welcome you, Dr. Doss.
Thank you. Thank you for that introduction, and thank you for having me here. I'm excited to present, and I hope I can provide some information to everyone tonight and answer questions that you might have. I know in my introduction, it was noted that I'm a pediatric psychologist, so I definitely have a lot of information related to youth and children with seizures and also non-epileptic episodes. So I hope to be able to answer questions related to that specifically. But I tried to create this presentation to be broad so that we could cover everyone in the room who might have interest and speak to some of the adult issues that might also be presenting for some folks. So I know that my PowerPoint should load probably. I'm not sure if I should do that or just wait, but I will. Oh, here we go. There we go. Thanks, Nikki. So we're going to talk tonight about epilepsy and emotional health. We can switch to the next slide if you can. There we go. So the goals for today's talk are going to be discussing, aspects that impact emotional health and epilepsy. This is a very broad range. We're going to be talking tonight about the things that negatively impact emotional health. But I think the goal for me tonight for everyone is to hear some ideas about how to promote positive emotional health in epilepsy. There are definitely things that come along with epilepsy that we're going to talk about related to emotional conditions like depression, anxiety, and other things like that. But not everyone who experiences epilepsy has those emotional conditions. And some of the reasons that they don't is that they get early intervention if they start noticing symptoms, or they get evaluated early just to make sure that everything's on the right track. And so I'm going to be just throwing out little tips throughout our talk tonight about ways to make sure that we're promoting the best emotional health for people who have epilepsy. We're also going to talk a little bit about stigma kind of at the end, which is fitting that that's going to go along with our talk tonight, since that's one of the initiatives that we have this month in Epilepsy Awareness Month is fighting against stigma. I think it's improved over the years since I've been working with folks with epilepsy, but I definitely think we have a lot of work to do to help continue to fight that. Kind of on a personal note, I became interested in working with folks with epilepsy because I have a young cousin. She's not so young anymore. She's now an adult, but when I was younger, who was diagnosed with epilepsy as a really young child. And so, and it had a significant impact, has had a significant impact on her life and development. So from kind of a personal family standpoint, I have a lot of experience, and then also in my professional world as well. So I hope I can be a resource to folks here. Okay, next slide, please. So, when we think about some of the things that impact emotional health for folks who have epilepsy, the most obvious, biggest thing is seizures. How many seizures people are having, how big the seizures are, meaning how impactful they are on the person's day. Do they happen multiple times a day, multiple times a week? Has the person only had one seizure in their lifetime? There's such a huge range for folks. And depending on what their personal experience is, can have an impact on emotional health. The other thing that most folks who have seizures have to also work with is medication. And when you take medication, sometimes everything is fine, and other times you experience side effects. And so sometimes the side effects from medication can cause people to experience different emotional symptoms. And we'll talk a little bit more about that when we get more into depression and anxiety and some of the symptoms that we see that go along with those disorders. But definitely for folks who have medication for epilepsy, some of the risk factors with those medicines is that it can cause these side effects in some folks. The other thing that we run into with epilepsy is that there are comorbid conditions that can go along with it. So depression and anxiety, which we're going to learn about in a minute, is considered a comorbid condition. So a condition that often goes along with epilepsy. Another thing that goes along with epilepsy sometimes is having different learning challenges. We're also going to talk a little bit about that later. And so some of those comorbid conditions can impact emotional health. Stigma, which, like I said, towards the end, we're going to talk a little bit more about stigma, what that is, how it impacts people differently. And then attitudes, beliefs, and experiences related to seizures. Historically, through history, when we look at how seizures have been understood, it's changed so dramatically from, hundreds of years ago to now. And I think even within people's families, their experience, their beliefs, their understanding of seizures and epilepsy can be very different. And so sometimes that can have a really positive impact on emotional health for the person if they feel well understood and they feel like everyone knows how to help them if they have a seizure, things like that. And then other times it can be a negative thing if people don't really understand it. And so, those are the ways, or those are some of the factors that impact emotional health. The impacts that stuff can have are on a person's ability to learn or ability to work. Like, for example, if a person is having very, very frequent seizures, it can make a normal functioning in normal day-to-day life difficult until we get those seizures under better control. Sometimes medicine side effects can be really hard for people too. It makes them very tired sometimes, or learning can be hard. And so some of the impacts that we see for folks with epilepsy are related to seizures, but sometimes it's related to other things that go along with having seizures. And so, I guess what I'm trying to get at is that epilepsy is complicated, and there's a lot of different reasons that people experience challenges to their emotional health when they have epilepsy. And it's really important to work with people who understand that so that you can tease apart what's the actual thing that's going on for this person and what's the best way to help them. How can we get them back to feeling normal and good in their life? Okay, next slide, please. So some of the things that can increase the risk for some of these emotional health challenges that we're going to talk about in a minute are, and these kind of examples that I have listed here are all things that have been taken out of more recent studies that we have been doing, looking at the factors that influence people the most. So early age of onset with epilepsy is a high risk factor for having learning difficulties, behavioral difficulties, or social emotional struggles. Having multiple and uncontrolled seizures through life. Seizures in school, I have on there partly because when kids are having seizures in school, depending on how it's managed there, that can have a significant impact on stigma, and it can also have a significant impact on the child's social and psychosocial development through time. And so that's part of why, and I'll talk a little bit more about this when we talk about interventions, but Like with the Epilepsy Foundation's program of Seizure Smart Schools, we've seen such a huge increase in schools being able to help students with epilepsy and help everyone in the community really understand it better. And I'm not saying we're there yet. There's a lot of work still to be done, but that's a huge impact. Medicine side effects, like we talked about. And then the last three little bullet points on there are related a lot to learning, like in how a person learns. And if learning is harder for them, then they're also more at risk for developing learning disabilities or having behavioral or psychological difficulties as they get older too. Okay, next slide, please. There's definitely a lot of different emotional health challenges that can happen for folks with epilepsy, but I'm going to cover the ones that are the most common. And then if people have questions about specific things that I don't cover later, we can get to that when we have the question and answer part at the end. But today I'm going to cover specifically depression, anxiety, learning struggles, learning disorders, and non-epileptic episodes or non-epileptic seizures. Next slide, please. So one of the things that we have come to understand as a society, as a community of folks that work with people with epilepsy, is that epilepsy is that mental health or psychiatric struggles are more common in people with epilepsy than in the general population. And what we see some of the statistics or the numbers that we look at are that like 30%, up to 30% of people who have what we call non-intractable epilepsy. So that means like epilepsy that has been well controlled with medication. That's when you're non-intractable. Up to 30% of those folks can experience some type of a mental health disorder at some point in their lifetime. So it doesn't mean right when they're diagnosed with epilepsy or when they reach a certain age or something like that. It's sort of in the course of their life, 30% of people have a likelihood to have experienced some type of emotional struggle. And for those that have intractable epilepsy or more complicated epilepsy, meaning seizures are not completely controlled by medication, it's up to 60%. And this, just so that you know, this is about 3 times the risk for people in the general population. So people that don't have any kind of a medical condition. Through my experience in working with kids with different medical conditions, folks with epilepsy are also at more risk than other types of medical conditions to have an emotional health disorder. And, you know, for a very long time in our world and in the psychology world, we sort of thought that that was related to difficulty adjusting to the illness. So like having an illness like epilepsy can be really hard sometimes, starting medication, having things change around in your life in order to manage the seizures can be really stressful. And that certainly can contribute to developing emotional health conditions in epilepsy. But the other thing that we also understand is that like everything, you know, all of our emotion and all of the way that we manage behavior and emotion is controlled by our brain. And sometimes the seizures themselves can impact the parts of our brain that also manage emotional health related things. So sometimes that is one of the reasons too that we see people struggle with different things like depression and anxiety. So it's a little bit different than some of the other medical disorders that people might have as far as risk. Next slide, please. So within epilepsy, the prevalence of these different psychiatric disorders are this. So for people with epilepsy, up to 30% of them will experience depression at some point in their lifetime. Anxiety is much higher, obviously, up to 49%, which sounds like a lot. When we were doing, as we have been doing this new onset epilepsy study, we have seen these numbers match what the national numbers are. So, so they're fitting together, and this is for both pediatric and adult. And then ADHD, which I'll go into that a little bit more, a learning challenge for folks a lot of the time, up to 40% of people with epilepsy have a co-occurring ADHD diagnosis. And ADHD stands for Attention Deficit Hyperactivity Disorder. Okay, so next slide, please. So now we're going to get a little bit more into like the specifics of what these different emotional health disorders are, and how we tend to see it present with epilepsy. So depression is a medical illness that can affect your body, your mood, and your thoughts. Depression can be diagnosed by a medical doctor. It can be diagnosed by your epilepsy doctor or by a psychiatrist. It's also often diagnosed by mental health clinicians, psychologists, social workers, counselors. Um, One of the questions that I have always been asked when people present with symptoms of depression is depression similar for people with epilepsy and for people without epilepsy? And the answer to that question is yes. The symptoms, which I'm going to go through on the next slide, are similar, but the reasons that people develop depression can be different. And so sometimes, like we were talking about before, when you have a new medical diagnosis that you're working on, or maybe you've had this diagnosis for a while and you're still trying to figure out how to manage it, that can be stressful and that can cause us to become depressed. But in other cases, like I was saying before, when you are having certain medications, maybe you have some medicine side effects, or maybe the seizures are affecting your brain in a certain way that affects that part of your brain that can kind of result in more symptoms of depression. Or maybe there's other situational factors that actually have nothing to do with epilepsy, but you develop depression. So all of these factors could be part of it. And that's part of why when you are wanting, if you're concerned about depression, or if you have a loved one that you're concerned that they might be experiencing some depression, it's really, really helpful to know, to try to meet with somebody, both your epilepsy doctor, but also somebody who, when they're assessing you, can understand how the epilepsy might be impacting you. And it doesn't necessarily change the way you would approach treatment, but it just helps to kind of inform how you got to where you are with how you're doing emotionally. One of the things that we do know for depression is that a combined approach of therapy, and there's a lot of different kinds of therapy out there, and I can explain that to you a little bit later. But therapy with a counselor and medication for depression is often thought to be one of the best combinations to make sure the person can kind of return to normal functioning fast. Now, medicine for depression is often something that's handled by a psychiatrist. Sometimes epilepsy doctors are open to prescribing medicine for depression, and sometimes they're not. So that's part of why it's really helpful to talk with your particular epilepsy doctor to know if they feel comfortable with that. And if they don't, then ask for a referral to a psychiatrist. And psychiatrists are the ones who prescribe medication for depression typically. Next slide, please. So some of the symptoms of depression to kind of be aware of, I have listed here on the screen. I broke it down between children and adolescents and adults, partly because depression can look very different in children than it does from adults. And even adolescents can look different than adults, but the older adolescents tend to seem a little bit more adult-like and might show the symptoms in more like an adult would. A younger adolescent would probably show it more like a child would, for example. But children have a tendency when they're depressed to become very irritable. So you might not see them crying or seeming sad, or even like what you would picture. If you think of depression, often as adults, we think of sadness or crying without understanding why, or a low motivation, fatigue, like inability to kind of get motivated to do things that you used to enjoy. Those are a lot of the symptoms of depression in adults and also in older adolescents. But in kids, what we see is irritability. That is probably one of the primary things that I look for. And very often what I will see is changes in friendships at school, more social withdrawal, decline in grades, and we'll see some what we call regressed behavior, which regressed behavior is like a child who's 10 years old might all of a sudden start to act like they're 6 or 5 even. You might see some significant like changes, like they've kind of gone back in time a little bit, and that's usually a sign for kids that something is really bothering them. It might not be depression, but something is usually really bothering them if we see that kind of stuff. With adults, with adolescents and adults, it follows more of what we might think of, what we've heard of or we've read about with depression, which is like sadness, loss of interest in things that used to be enjoyable. Sometimes we'll see some significant weight changes, changes in friendships, isolation, difficulties with concentration and attention. And at the bottom of the list on both of these, for children and for adolescents and adults, I have thoughts of death. And one thing that's really important to know is that coming along with depression, and it doesn't even have to be severe depression, people will often have thoughts of death. And kids will actually, really even very young kids will experience thoughts of death or suicidal thoughts, thoughts of wanting to harm themselves or thoughts of dying. And I'm bringing that up not to be frightening, but just because it's something that goes along with us, and it's so, so, so important for people, if you have any inkling that that's going on, to get it evaluated right away. I think there's definitely some things that we'll get into as we talk more about prevention and managing some of this stuff, but those are things that come along with depression pretty regularly for people, and it's just something to be aware of. Okay, next slide, please. Now, anxiety is a little bit different from depression, although some of the symptoms can kind of overlap. We'll talk about that in a minute. But anxiety disorders are also a medical illness that cause people to experience kind of irrational fears or dread or a sense of foreboding. There can be a lot of physical symptoms that go along with anxiety. This is true for depression too, actually. I should have probably put that on that slide. People can have a lot of physical body symptoms when they're depressed, like fatigue and even aches and pains, things like that. That's also very true for anxiety. A lot of people will experience anxiety in their body and not even recognize that they're that anxious. That is very true with young kids. So they'll have a tummy ache, or, even adolescents. I have terrible headaches. I need to sleep all the time. I'm terribly fatigued. A lot of the time, anxiety can present this way. And when you ask them, do you feel anxious? Are you stressed? People will say, oh no, I'm fine. But what we can sometimes watch people's behavior to help us understand a little bit more about how they're feeling. And that is one of the things to watch for, especially with kids and adolescents. Anxiety can also be diagnosed by a medical doctor and a mental health provider. It is similar. Anxiety is also similar for people with and without epilepsy. One of the differences, of course, is that people can be quite anxious about seizures if they have epilepsy and when another seizure is going to happen. One of the hardest parts about epilepsy, I think, for a lot of folks is the unknown, not knowing when they're going to have a seizure, especially if their seizures aren't well controlled. And that just makes it that much more important to have a team around the person to make sure they're very supported in every setting that they're in so that they feel safe. And then that doesn't take the anxiety away necessarily, but it often will help to reduce it quite a bit. Next slide, please. So some of the symptoms with anxiety that we see are school avoidance, and I should also have put in there, work avoidance, fear of separation from parents or loved ones. Somatic symptoms is what I was just talking about, physical body symptoms that the person might not necessarily recognize as being anxiety, but is. Psychomotor agitation is kind of like just sort of fidgety and uncomfortable, or if you kind of tapping or moving or fidgeting or moving around a lot, just sort of restless and uncomfortable. We also look for changes in social relationships and avoidance or isolation from things that used to be enjoyable or more comfortable for the person. Increased irritability is also very common with anxiety, both for kids and adults, I think. And I also have on here thoughts of death. And this is one thing that often surprises people, but when people are very anxious, they will also have suicidal thoughts. And so it's again, another thing that's really important to assess. If you get concerned about anxiety for yourself or someone you care about with epilepsy, it's important to get it evaluated, because this is also one of the things that we can see with anxiety. Next slide, please. So learning disorders, like we talked about in those first few slides, are one of the things that we see come along with epilepsy too. And this can be related to seizure frequency. It can be related to medication side effects. It can be related to where the seizures might originate in the brain if there is a specific spot. Learning disorders are, this is broad, but they're difficulties related to memory, attention, concentration, and other cognitive processes like that just involve learning, basically being able to take in information and use it and learn and remember it. Learning disorders are diagnosed through a formal evaluation with a neuropsychologist, and a neuropsychologist is a person who does testing, kind of like academic. It's similar to academic testing, but a little bit different. There's some really standardized tools that people use in order to assess specific areas of functioning for a person. And so if you are concerned about this, or you're concerned for a loved one, it is really important to get that evaluated, because there are some things that can be done to help accommodate and manage learning struggles, both at school and in the work setting. Okay, next slide, please. When we're thinking a little bit about like kids with epilepsy, in one of our recent studies that we were looking at, about 2/3 of kids report some kind of learning struggle or learning problem. This doesn't necessarily mean a learning disorder. So a learning disorder is at a level where we might be able to get some intervention through the school, for example, or even at work for different accommodations. Learning problems is a more generic term, and it doesn't necessarily rise to that same level of disorder, but it does mean that the person is struggling with something related to learning. So about 2/3 of kids will report that they have some learning struggle. Learning difficulties might be impacted by the seizures themselves or by the medication. And sometimes when a person's seizures are under really good control, their learning improves, but that's not necessarily the case in every situation. What we have found too is that when a person's epilepsy is well controlled and they can come down a little bit on medications, sometimes if those medicines were impacting the person's learning, like making them more tired or something like that, then we will see the person's learning struggles improve. So that's one of the things that we will see as seizures get under better control. Next slide, please. Now, attention deficit disorder is a very common co-occurring condition. It's an area that impacts learning pretty significantly. And it's a very common, like we talked about earlier, a very common co-occurring condition that we see with epilepsy. Attention deficit disorder impacts a person's ability to pay attention in a setting, take that information and concentrate on it, put it into memory, and then use it later. And we do see it having a significant impact. Treating the attention deficit disorder can be very helpful. And when I say treatment, what I mean is medication for it. So that is, there are behavioral strategies, of course, as well. But one of the things that, at least in this particular research study, they found that treating the attention deficit with medication can really significantly improve the person's ability to manage those symptoms of ADHD or ADD in the school setting, especially, and improve their functioning there. Next page. Thank you. So I'm going to talk a little bit now about non-epileptic episodes. Non-epileptic episodes are common co-occurring condition also with people with epilepsy. What we have found for people with non-epileptic episodes is that let's see, how should I say this? In people with non-epileptic episodes, about 30% of them have also had epilepsy in their lifetime or have a co-occurring epilepsy. So that's why it's important for me to talk about it today. Non-epileptic episodes, if you haven't heard of those, involve changes in behavior, and they can, and emotion and interaction and body movement that can resemble epilepsy, but are not associated with abnormal brain activity. So a person can experience a symptom that might, to us with our eyes, look just like an epileptic seizure, but in fact, it's actually not being caused by the things that cause epileptic seizures. That is hard sometimes, especially if a person has both epileptic and non-epileptic episodes. Non-epileptic episodes are very often caused by underlying psychological stressors. So anxiety is one, depression, other kind of conditions. Sometimes they've been treated, but sometimes they haven't been. Sometimes the person is very well aware that they have these stressors, these psychological stressors, and sometimes they're not. Non-epileptic episodes are best diagnosed by the medical provider. So if you have epilepsy and you have these symptoms that don't fit with your typical seizures, you would want to have those evaluated by your epilepsy doctor to see if they are in fact a different type of seizure or if they are non-epileptic. And we see people also who come into the hospital for their first time seizure, and it turns out that they aren't having epileptic seizures at all. They're having these non-epileptic episodes. Non-epileptic episodes do not require the same type of treatment as epileptic seizures do. Medication for epilepsy does not treat non-epileptic episodes. And the best form of treatment that we know of right now anyway is outpatient therapy. And so this is, like I said, a common co-occurring condition with epilepsy and something that we see quite often for people, especially in epilepsy units. Okay, next slide, please. So one of the things that, the whole reason that we're talking about this today is preventative, I think, is to help people recognize the signs that they should look for so that if they or someone they love has epilepsy, they kind of are on watch for any emotional health struggle that might be happening. Just because it is so much more possible for people with epilepsy than even people with other medical conditions, like we talked about, to develop emotional struggles. I think that when you notice there is something that you're concerned about, the first thing to do is talk with the epilepsy doctor and get advice. Find out if that doctor is concerned about it or wants more of an evaluation. The Epilepsy Foundation, especially here in Minnesota, is excellent and has so many resources for people, from young kids all the way up to older adults. And so I always think that seeking their advice about how to either get an evaluation, who to see, should I be concerned, how do we get help for this? The National Epilepsy Foundation has a website as well that also provides a lot of information. And then there's also some videos and things that you can link to get more information about any of these things that I've talked about today. It's always really helpful, I think, to catch things early rather than waiting for them to become worse or harder over time. And so it never hurts to have an evaluation with a mental health clinician, like with a psychologist like myself, or a social worker or counselor, if you do have concerns or you're wondering about some type of symptom that you think could be depression or could be anxiety. And the other piece that I think is very, very important, and sometimes this is really hard to do on your own if you don't have experience with it, is work with, like, if you have a child with epilepsy, work with their school, or if you are a person with epilepsy yourself and you are work with the people in those organizations to make sure that there's a plan in place to help you if you need something related to your seizures. I think the first step is for people to feel like they have a support system around them. And then if anything does happen, they know that they can lean back on that support system to help them through whatever it is that's going on. The Epilepsy Foundation of Minnesota, I mentioned this already, has the Seizure Smart School program, which I think is excellent and is so helpful in getting schools resources for kids and teenagers. And I think that there's also a number of different things that are available for adults through the Epilepsy Foundation as well. Just different resources to have ideas to how do I work with somebody in work, or how do I make sure that I advocate for myself if I need to in certain ways. And all of those things I consider kind of preventative strategies to help ward off the possibility of some of these emotional health conditions developing or not being caught early. Okay, next slide, please. So we're going to move now to talking a little bit about stigma, which is one of the things that I mentioned earlier and can cause some struggles with emotional health. Next slide, please. Stigma is basically, there's a lot of different definitions for it, but one of the things that we think about with epilepsy is that stigma occurs when a person is labeled by their illness and they're not seen as being separate from it. Sometimes when this happens, not just with epilepsy, but with any medical condition or even any psychological condition, a person can feel labeled and then discriminated against or not given as much opportunity because of this particular condition that they're experiencing. I think definitely in history, people with epilepsy experienced this a lot. Also very true for people with different psychological struggles. Over time, there's been a lot more education and there's been all these pushes to try to get this information out so that people understand the illness better, because understanding helps to breed empathy from people and the desire to be helpful instead of the desire to hold back from helping. And so I do feel like we've made some inroads with stigma, but I definitely think there's still some things to work on. Next slide, please. So one of the things that we see related to stigma and how it can affect psychosocial development is that it can cause a person to experience a change in the way they see themselves. It can cause them to feel low confidence in being able to be an advocate for themselves. It can also cause people to become socially isolated. So one of the things that I have seen, especially with kids, but I'm sure this happens with adults as well, is that when they are given the diagnosis of epilepsy and then they're trying to develop ways of managing it with their family and with school and people in the community and sports and all that kind of stuff, it can be very overwhelming. And I think this is true for a lot of people. When we run into something overwhelming, we pull back and we sort of want to like get all our ducks in a row so that we know, so that we control the situation as much as we possibly can. Totally understandable. That's like a very natural human reaction. But one of the things that happens with that is that for some people, that will mean they're going to hold back telling people that they have epilepsy. Or like for kids, we're not going to share it with the school, let's say. Or we're only going to tell our family members, but we're not going to tell any of the person's close friends because they're worried about stigma. They're worried about discrimination or somebody looking at the person in a certain way and changing their attitude changing toward them. But one of the things that this does sometimes for the person with epilepsy is it causes them to feel more isolated, or it causes them to feel like they should hold that information back. And then when that happens, that is how stigma, that's a result of the stigma. And then that can breed some of the emotional problems we talked about earlier. It can breed anxiety, it can breed depression. And so one of the things that I always advocate for with people is get a network around you of people that you can tell and that you know will support you through it, and be a good advocate for yourself. And we work together on sort of training to be an advocate for yourself so that you know how to talk to people about it. You know how to ask for what you need. You know when to set certain limits so that we can try to avoid some of that impact of stigma that stigma can have. Next slide, please. One of the things, and this slide is specific for kids, but I think it occurs with adults as well. Bullying is a huge issue. I think bullying is a big issue just in general, but when it comes to epilepsy and having epilepsy in school or in front of other people who don't understand it, it can be the risk for the bullying is even higher. And this study, and while this study is old, it's from 2002, and I do think there's been improvement since then. When you look at some of the percentages in this slide, it talks about how people so many people, when they answered the questions like, what is epilepsy? What's your attitude? Or what do you know or understand about epilepsy? So many people didn't know anything about it, the teenagers that answered the study. Many people still had beliefs that it was contagious, or that there was something that was going to happen, or, you know, something that they didn't understand, worried about not ever having seen it before, not ever having experienced, knowing a person who'd experienced seizures before. And because of that, they had, you know, beliefs and attitudes that were probably from way, way back in history that weren't accurate at all, but they just hadn't been given any education so that they had new information. Now, I think this, like I said, has changed quite a bit with the seizure smart schools and things like that. But certainly, like, not every school has been trained in seizure smart schools yet. So it's the type of thing that we have to be constant advocates, and be putting information out there that's accurate, so that everyone who experiences epilepsy can be helped, with at least people around them who understand it better and have more accurate information about it. Next slide, please. The other thing that we're dealing with now, which was never a factor when I was young, of course, is social media, and like the rate at which things spread online is so incredibly fast. It's like wildfire, and it's really challenging to kind of get a handle on it when it goes out really quickly like that. This can be put to good use, or it could be put to bad use. And I think one of the things that you see, and when people are initially diagnosed with anything, one of the first things we all do is like go onto Google and try to Google it. Like, let's understand what this illness is and what it's about. Unfortunately, one of the things that we'll see is that a lot of what you find isn't accurate. And sometimes it can kind of perpetuate that stigma that I was talking about, because the information, when you read inaccurate information, then suddenly your perception and your attitude about the thing that you're reading about changes. And so I'm always also encouraging people, try to make sure you're going to like sources that are going to give you the best information out there. And also, if you see misinformation out there, try to figure out how to correct it. Teens are really good at this, actually. They are so savvy at social media, and probably a bunch of young adults are as well. I don't put myself in that category. I don't know how to do anything on social media, but you know, the younger generations do know a lot about it. And so I think we can use that as a force of good if we try, and it might be a great way to disseminate a lot more information about this stuff. But it's something to be aware of, that a lot of what is out there can be negative, unfortunately, and not accurate. Next slide, please. So some of the things that are on this slide are things that I've already talked about. This is specifically about kids, but I think this applies to adults as well. One of the things is education. The unpredictability of epilepsy and the hidden nature of it is one of the things that makes it so hard to manage for people, because you would never know a person was going to have a seizure until they have a seizure. And so it makes it easier to keep it to yourself that way, but it can also make it more likely for the person to have a struggle after a seizure happens if nobody around them has heard about it or knows what to do to help them when it happens. I think it's really important to do a lot more with anti-bullying, just both for epilepsy and for other things. But I think being really a strong advocate, both for yourself and also for other people who have the same condition, is very, very important. And I think having a team approach to that is really helpful as well. Next slide, please. And this is just sort of like a summary a bit of what I was talking about before. If you can have supportive counseling or a team around you who will help with understanding medication, managing lifestyle, talking about driving and what to do if you can't drive, ways of coping with epilepsy, ways of managing stress. This is all very helpful in preventing some of the emotional stuff that we were talking about earlier. Next slide. So some of my final thoughts are emotional struggles are something that occur commonly for people who experience epilepsy. The reasons for this are very broad. Some of the reasons have to do with the seizures themselves, co-occurring mental health diagnoses, and stigma. I think if you take anything away from what I said tonight, early intervention and preventative stuff is so, so important. And that is probably the most important thing when it comes to managing emotional health related things. And also use the resources you have available. The Epilepsy Foundation is a great resource. There's other ones out there, but with Epilepsy Foundation of Minnesota being such a strong group, they can really help assist you in getting to the next steps of both getting assessed and having some intervention if you need it for any kind of emotional health challenge. Next slide, please. So I think that's it for my formal presentation. And now I'll give it back to Dr. Heck and can go from there.
Thank you, Dr. Das. What a wonderful and clear presentation. Very good information. And I hope to be able to talk more about some of the information you spoke about tonight and just have a discussion about that too. I'd like to introduce our panelist, our next panelist. If Kay, you want to come on? There we go.
Yeah, thank you.
Good. I'd like to introduce Kay King. She is an older adults program coordinator and a community educator at NAMI, which stands for the National Alliance on Mental Illness of Minnesota. This is her 13th year providing mental illness education, support, and advocacy. Annually, Kay teaches about 4,000 professionals, family members, and people managing a mental illness in classes ranging from 1 to 8 hours. Kay is the former executive director of a retirement community in the Twin Cities and managed a home health care agency. She also was a hotel and resort manager with over 25 years of hospitality industry experience nationally and internationally. Kay is a family member and teaches NAMI's Family to Family 8-week education course and is a mental health first aid and youth mental health first aid instructor. You sound like a very busy person to me, Kay. And these next few minutes, we're going to take some time to go through some questions that our participants are sending us. And while we're going to give them some time to send us some more questions, I thought we would talk about some questions that our panel was asked by EF to discuss as well. These are questions that are commonly asked about mental health. But Kay, I was wondering if you could take just a few minutes and just talk with us about what you do. I know we just read your bio, but tell us in your own words about what you do and why you're here tonight. Why are you spending time with us?
Happy to, Dr. Heck. First, I'm just going to do what I call the 2-minute primer about mental illness. I'm guessing that in 10th grade health class that you didn't have very much training on mental health. You might have learned the pathology of mental illness. You might have learned about Freud or, B.F. Skinner, but, the practical things you need to help a family member or help a coworker or help, someone who's your neighbor. We don't really get very much of that in 10th grade health class. So some basics. It's an early onset illness. By age 14, 50% of people who are going to have signs and symptoms in their lifetime have them by age 14. It rises to 75% by age 24. So it's a young person's onset. And like all illnesses, including epilepsy, it's best to get early help, early intervention. People do better. Don't wait till you have stage 4 cancer. Try to get, help when you have stage 1. Also, people wait a long time to get help when they have symptoms. The average is 10 years. So half the people get help before 10 years, half the people get help after 10 years or never get help. And if you don't get help or you wait that long, you could get in the criminal justice system. You could drop out of school. You could have relationships that end, marriages, partnerships. You could be estranged from your core family. You could lose friends. You also can develop other health issues because our head is connected to the rest of our body. That's what integrated medicine's about. So it's just really important, to get help. I also want people to know that mental illness is very treatable. People get better. So that's important. And I also want you to know that anxiety disorders, that Dr. Dawes talked about, they're the most common of the mental illnesses, about 3 times more common than major depression. Not very many people live with schizophrenia. That's fairly uncommon in the general population. Eating disorders are a mental illness, and they're also the highest death rate of all the mental illnesses are eating disorders. So, they're important to take care of if you have an issue with that. And there's a 50% lifetime prevalence for mental illness for the general population, 50%. It's 1 in 5 in a given year for youth and adults. So 20% of our population in a given year are managing, an illness. And the main reason that people wait those 10 years to get help for their signs and symptoms is discrimination and stigma. So that's not unlike epilepsy. So if you live with both, you can imagine certainly, you've got a pretty high hurdle that you need to cross, to be able to get the help that you need. So that was, pretty quick primer, but
Wonderful.
I also, do lots of classes, but we have support groups at NAMI. During COVID-19, they're online. They're family support groups for family members and support groups for people who manage mental illness. We have a helpline that's a business hour helpline, not a crisis number. And we also do lots of classes. I teach adults primarily, but we have a children's team, that works with parents and teachers, that work with young people under 18. So that's kind of an overview.
Wonderful. Thank you.
You're welcome.
Well, I think one of the things that I'd like to just kind of emphasize tonight, I think that all of us participating here tonight, including the Epilepsy Foundation, believes that a comprehensive approach to managing epilepsy is what's important. And what we mean by that is that it takes not just a doctor's visit to figure out what medication might be helpful, or a discussion with a nurse about how best to take the medicine or some other medical issues, but it really does take a combination of people and approaches to help people improve their lives when they do have epilepsy. And this is one of the reasons why we're doing this tonight, is that there are understandably a lot of struggles for the person with epilepsy as well as family members around that person. And a lot of times what we are discussing tonight is we are talking about mental disorders and diagnoses and that kind of thing. But I think the important thing to understand is that according to Dr. Dasa's information she gave us, is that people with uncomplicated epilepsy, about 30% of those individuals go on to actually have a mental health diagnosis. I think, am I correct about that, Dr. Das?
Yeah.
And so that means that 70% of people with uncomplicated epilepsy are not ever diagnosed with a mental health condition. And so the information we're talking about tonight, I think it's important to understand that there's differences between somebody being down or discouraged and somebody having a disorder or a diagnosis of depression. There's a difference between a child who is fearful of going to school because of having seizures versus a child who may have an anxiety disorder. And so we see in the vast majority of people at some point in time in their lives who have epilepsy is that they're going to have some emotional difficulties, but may not necessarily have an emotional disorder or a diagnosis. The reason that we separate these out is that being discouraged or sad or sometimes upset or even irritable at times is normal. That happens for people who don't have epilepsy, and it certainly happens for people with epilepsy. The importance of understanding about whether that represents a diagnosis or not is because if there is a condition like an anxiety disorder or a depressive disorder, those conditions can go on to cause more difficulties for the individual if they're not caught early. And so one of the reasons that we're talking about this tonight is that it's important to be able to understand that if certain things are occurring that are creating an actual condition, those are the conditions that people really do need to seek some help for. Otherwise, if they have a child who's irritated or somebody else is particularly fearful about something, a lot of times family members teachers, social workers, neighbors, all sorts of other people can be part of the team to help that person work through some of those difficulties. I don't know what you guys think about that.
Mhm. Yes, I agree with you. Yeah, I think that it's important that it's hard. It's not always easy to distinguish when to be concerned and when not to be concerned. And I think like the most important thing is make sure you just know who to ask the questions to, like make sure that if you have a question or a concern, you ask it. And I think most people will do really well and have those supports around them. And they won't need intervention, and then some will. And I think one thing to just know is that you're not alone in it, and there's people out there who have experience with this that can walk you through it. Like I've highlighted a bunch of times, the Epilepsy Foundation is a great resource. NAMI is a great resource. So
Yeah.
mhm.
I think you can't not talk about the elephant in the room. We're 9 months into COVID-19, and I consider COVID-19 a catastrophic stressor. So in mental illness, we talk about that you're probably born with a predisposition. Something puts it into motion, called a second hit. And certainly I classify COVID-19 as a second hit. Doesn't mean you're going to develop a mental illness, but I would say many of us are experiencing some anxiety because we don't know what the future holds. We're worried about our own health, worried about the health of others that we come in contact, including our older relatives. I would say that the economic parts of people being laid off and people being downsized. I think we also have the racial injustices. The tipping point, was Mr. Floyd's, death in May, and we had elections. So that doesn't mean you live with an anxiety disorder or major depression, but boy, these have been tough 9 months for people, including people that live with epilepsy and including children.
Right. I think that's a wonderful point. And I think that one of the things that I've tried to do over time is trying to help people become a little bit more comfortable with the fact that they're uncomfortable. Meaning that just because somebody has some fear doesn't mean that there's a problem that they have to necessarily fix or that there's something wrong with them. As you just pointed out, our world today has some very legitimate reasons why people might be down or discouraged or fearful. And I think to some extent, it's important for people to know that that's normal and that it's understandable given the circumstances. And it doesn't necessarily mean that they have a mental disorder or that they need to go in and get help or get on medication, et cetera. Generally, in the mental health world, when we separate out symptoms from a condition, it's really about, are those symptoms causing the person a significant problem? Meaning, are your depressive feelings causing you to not eat or not sleep or to lose weight or to lose relationships? And generally, when those kind of problems start happening, that's when we start taking it a little bit more seriously and say, well, maybe it's important to get some help. But it's also important to understand that to some extent, having some of these emotions is pretty understandable today. And we have to have a little bit of tolerance that day to day we may feel good or a little bit less good from day to day. We have a nice question, I think, that would be good to get to, that we actually have several questions here. One of them is a question that is saying, does everyone who has epilepsy experience depression, anxiety, or ADHD, or any other emotional mental health issues? So this is a question that I think we've talked about a little bit already. Does everyone have these conditions? Dr. Doss, you want to speak a little bit more about that?
Yeah, no. The answer is no. I think the risk is higher, like we talked about, for people with epilepsy versus other medical conditions and even the general population. But that certainly does not mean that everyone experiences it. And like Dr. Heck was saying just a second ago, the list of symptoms that I put up on the slides are kind of a range of what you'll experience with anxiety or depression or some of the other mental health conditions that people have. And if you have one of those things or two of those things, that doesn't mean that you have a diagnosable condition. It's definitely something, though, to watch for. I think it's something to watch for in yourself and in the people that you love. who have epilepsy. If there are things that pop up that you are concerned about, it's good to make sure that you get it evaluated. But certainly it's not every person with epilepsy. In fact, like the most recent statistics that I was seeing were like 30 to 35% of people with epilepsy will have a co-occurring mental health condition at some point in their lifetime. So that's like 1 in 3 people, not all 3 people, for example. But there's a lot of factors, like we talked about, that influence whether a person develops those conditions. And it's such a people are so complex. I just think people are so complex. If you have any questions, you just definitely have to just ask the questions to the people who can help you.
I
People
also
are
think-
wonderfully complex.
Yeah. Mm-hmm.
This is one of the reasons that many of us enjoy what we do.
Yeah.
Is because we learn every day, and it's not always easy to figure things out, but there are ways to get help for people. So good. I think the bottom line with that particular question is the majority of people with epilepsy do not have mental health conditions, but my guess is, just like most human beings, they do have their days when they're not feeling so good about things. We have a second question here that I think that it'd be nice if all 3 of us could participate in. This person is writing, who's saying that I have a son who experienced 2 full-blown seizures recently at the age of 16. His first one was in February and a second one in June. He's now on Keppra. After listening to your presentation, I feel we need help for our son for depression and anxiety. He was seeing a therapist prior to his seizures. He now refuses to continue. Any recommendations on what we can do to get him help? He's not open to the idea of another therapist. So one of you want to take that? Okay, do you have some thoughts on that?
Thoughts, I'm not a clinician, but being a family member, it's understandable because of stigma and discrimination that people, don't want to be labeled. They don't want to be crazy, nuts, cuckoo, psycho. They don't want to be called a diabetic. They don't want to be called an epileptic, And so, I'm sure that a 16-year-old would just like to be a 16-year-old and all that entails. So I will recommend a book that has kind of a catchy title, but it's called I Am Not Sick, I Don't Need Help. And it's a book about communication strategies. It's by Javier Amador, and Amador is the name. And I'm just going to ask, we have a great person that's doing our tech, but it's Javier, Xavier, Amador, AM as in Mary, ADOR. I am not sick, I don't need help. And we also teach a class at NAMI called Hope for Recovery. And when it can be in person, it's 6 hours on a Saturday, but we've adapted a little bit to online classes. And they use some content from that book in the Hope for Recovery class. And then the book, you can get it at the library and things like that. So it gives you some communication strategies. And I also am a big proponent of the philosophy of that when the pupil is ready, the teacher appears. So have your resources ready and keep the dialogue open so that when the person is ready, including a 16-year-old, then you're ready to connect them to the resources that they need.
Thank you. Thank you very much. I'll comment a few things, and then maybe Dr. Das, you could as well, because there's a lot of different ways I think to help and think about helping this 16-year-old. I think the main thing that I think about is to not make it a power struggle and to not force the issue on this particular teen. And unless this 16-year-old has such severe symptoms that you think that he is at risk for suicide or possibly self-injury, in that case, I would certainly think about going in and having him go in or going in with him to his epilepsy physician or general practice physician, and being able to talk about it that way, or just talk with him more about that and see about to what extent he might need a safety plan. But if the teenager is experiencing less severe depression and anxiety, I think I would try to open a dialogue, as I'm sure you already have, about why he may not be interested in seeing a therapist. And I would use as part of that dialogue to be able to talk about what you see as parents that are problematic, meaning, is he not eating? Is he isolating more than usual? Is he really irritable and getting into a lot of arguments, and just being able to have an open dialogue about what's going on that you have concerns about. And to some extent, I think teenagers who may be experiencing some depression and anxiety, again, some of that at a lower level may be understandable because we're living in extenuating circumstances right now. Kids are isolated, and so some of that is going to occur to some extent. And I would also think about if there's any interest of your teenager in being able to talk with other teenagers who might be going through epilepsy, because sometimes us adults have all the wisdom in the world, but kids aren't always very receptive. And so there may be some online groups through the Epilepsy Foundation, or through some even individual contacts through the Epilepsy Foundation, that the person or that the teenager might be willing to talk with somebody else or chat with somebody else about their experience and just be able to connect. And lastly, I would just also be looking at with this particular teenager about whether he would be willing to follow some general, I would call depression prevention strategies, which to see if he's not willing to see a therapist, is he willing to work with you as parents to help make sure that he's sleeping well, help ensure that he's eating well, making sure that every single day there's something going on that he finds meaningful, because life can become a drudgery during these times, which can add to depression. So there might be some things that as parents or even other family members can do that could help this teenager as well.
Mhm.
Dr. Das?
Yeah, I think those are great ideas. Let's see. I've worked with a lot of teenagers. I work mostly with teenagers, and I find that some of them want to come to therapy and they're excited about it, and they're like, I need help and I'm overwhelmed. And a huge number of them actually don't react that way, and they feel scared about it. And even if he's already had therapy, after having a diagnosis like this, and maybe now he can't drive, or he had to put that on hold, or there might be some changes for him that have come along that are kind of overwhelming. It wouldn't surprise me if the thought of like digging into all that just seems like very overwhelming. So, what I often do, I have a lot of families call me and ask me these same questions. Like, what do I do? I know that they need to see somebody, but I don't know how to get them in. So I'll walk through with them a little consultation of like, here are some questions to ask. Here are some ways to kind of probe a little bit about, what are you worried about with going to therapy? Why not try it one time? See if you can kind of lighten it a little bit, not have it feel so serious. And then the other thing that I will often do is offer to meet with the kids. And I know a lot of pediatric teen therapists who do this, where they'll offer to meet with the kid and the family one time for kind of like, it'll be like an initial consultation session, but just like let's feel each other out. Let's see how this goes. And 9 times out of 10, when we do that, the kids are like, yeah, I'm going to sign up. It's sort of that breaking the ice a little. If he's willing to do that, if he's willing to take that step, then with no obligation, kind of like, I wonder how it would feel to just meet with this person and just feel them out and see if they can offer you anything. Sometimes when they don't feel like they have to like sign in blood before they start something,
Right.
for a teen, that feels a lot better.
Yep.
And then usually like once they kind of meet with me or someone like me, they're kind of like, oh yeah, actually,
Yep.
might be helpful. So that's one of the ways I would maybe try to approach it if you are really concerned, if there's something that you feel really concerned about.
I really like to be sure that people understand, my philosophy about therapy is that I really see it as an opportunity for children and adults and adolescents to grow.
Mhm.
Therapy isn't always something to participate in because somebody is doing something wrong, or they're flawed in some way, or there's something really deeply wrong with them. Living with a medical condition is difficult. And so sometimes therapy is seen as just another part of the medical team, just like a social worker, a nurse, you know, a teacher and all sorts of other people can be part of that team. So normalizing the therapy can sometimes be helpful. So we have another question to get to, panelists. And this is a question, this is a kind of a discussion about anxiety. And it says, I was diagnosed with epilepsy at the age of 2 years. There was a period of 9 years that I did not have seizures. In my sophomore year of college, it came back. The seizures I experienced as an adult feel the same as the seizures I experienced when I was younger. However, my current doctor believes that the epilepsy I'm experiencing as an adult is caused by anxiety. I don't feel my epilepsy is being caused by anxiety. Can anxiety really cause epilepsy? So
Dr. Goss?
I can say a few things, and we've got about 10 minutes left, so we have another question as well. So we can maybe say a few things. This is probably for Dr. Das and I to talk about a little bit. So I think there's a difference between thinking about anxiety causing epilepsy and anxiety causing seizures. And I just want to make a kind of a small, it's important distinction. Epilepsy is not caused by anxiety. Epilepsy is a condition in which there is something that is not functioning normally within the brain that then causes seizures to occur. So anxiety doesn't tend to cause something to go wrong in the brain. But what can happen is if somebody does have epilepsy, that anxiety sometimes then can cause seizures. And those seizures sometimes can come about if the person has a lot of anxiety because they're not sleeping well, they maybe are missing some medication doses, or they're so fearful of doing something in their life that they're staying away from things that are really important to them, and they're running into difficulty in terms of managing their life. And sometimes that can cause seizures as well. So in a real brief response to that, epilepsy is not caused by seizures, anxiety, but sometimes seizures can be triggered by anxiety. And then Dr. Das, I think you have worked with non-epileptic seizures quite a bit, so you could speak to that, because this person may be discussing that, maybe thinking about that as well.
Right. And that's, and that would be the question that I would have for the person who asked the question is, non-epileptic, I try to make the distinction between epileptic seizures and what I call non-epileptic episodes, which are, can physically look the same as a seizure, very, very, very similar to an epileptic seizure, but are not being caused by those abnormal kind of electrical things going on in the brain. And often the way this is described to folks is that they're experiencing stress. And I'm using quotes because stress is so broad, it's like hard to really know what that means sometimes, or anxiety. And it causes these seizure-like episodes. They're not actually epileptic seizures. They're what we call non-epileptic, totally different thing. But they cause your body to do something similar. They cause your body to lose control. Sometimes you even lose awareness. Sometimes they can feel very similar to an epileptic seizure. They can look, like I said, to people who don't know about epilepsy, very much like an epileptic seizure. And so that would be the question that I would have actually for you to ask your doctor. Are these non-epileptic episodes instead of being called, or instead of the thought of it being epileptic seizures caused by anxiety? Like Dr. Heck very nicely explained his thoughts on that. If they're non-epileptic episodes, not the abnormal brain activity, then they can be caused by stress or anxiety. And it's very, very common for people that are experiencing them to not even recognize that they are experiencing anxiety, or even feel like the stressors that they have going on are different or hugely significant stressors. That is actually, in my experience, more common for people to be like, I'm not really stressed. I'm not really that anxious. This is so strange. How come my body's doing this? And that's why if you work with somebody, Dr. Heck has a ton of experience with this. I also have a ton of experience with this. If you work with people if you work with somebody who understands it, they can help explain to you how your body does this, like why your body's doing it, how it does it. And then, we sort of investigate together, why is this happening for you? Because like I've said a couple of times in this talk, people are so complicated. There's so many different reasons that these things kind of happen for different people. But if you work with someone and you kind of investigate together, you can usually come to a good understanding of what it is and why. So I hope that helps answer that question. I feel like I'm talking really fast, but.
Thank you.
Mhm.
It made sense to me for sure.
Mhm.
There's another similar question here. Somebody else is asking, why would someone develop non-epilepsy or non-epileptic episodes after years of not having them?
Mhm. After years of not having seizures, maybe epileptic.
Well, it says this person, why would someone develop non-epilepsy or non-epileptic events after years of not having them?
Mm-hmm. Well, that's a good question. Again, it's a really complicated answer. I mean, in the sense that everybody's a little bit different in why they develop these things. Non-epileptic episodes are caused by what I think of, the way that I explain it to people, is like a buildup of stress, a buildup of stress in the person's life. And this can be stress that happened years ago that wasn't managed in a way that made the person, and then it comes back up for them. Or it can be stuff that's going on in life currently, and there might be multiple things that are happening for the person. When I'm working with kids who experience it, for example, it can be school stressors, friend stressors, family stressors. They have a big test on Friday. It can be like, and as I'm saying all those things, you're like, well, yeah, that's normal, right? Like those are all normal things that we go through. Yep, they are. And that person, their body's way of reacting to it is to have a non-epileptic episode, a thing that looks like a seizure. Someone else might get really sad and cry. Someone else might be like, oh, I'm so overwhelmed and have a panic attack. But for that particular person, and for reasons that we are still trying to understand as a medical community, that person's body has decided to have something that looks like a seizure. There's a lot more to it than what I'm explaining, but it's a mind-body sort of reaction. People always sort of take our mind and put it over here, and our brain and our body and put it over here. And I always say everything that affects us emotionally affects us physically, and everything that affects us physically also affects us emotionally. And so it doesn't ever surprise me when a person has a physical symptom in reaction to stress, because, well, yeah, of course, like, and vice versa. If somebody has a medical thing going on and then they have an emotional reaction, well, yeah, of course, it's all the same thing. It's all up here. We are very complicated beings, and our brains are super complicated. But I think that that's how that can happen. And yeah, go ahead.
Thank you.
Yeah.
You. And the thing that I would add to that is that sometimes when the word stress gets discussed, there's various types of stress. The type of stress that Dr. Doss is talking about is the type of stress that most of the time people are aware of. When your doctor says, I think you're under stress because you're not doing so well in school, or you lost your good friend or something like that, a lot of times people with epilepsy are aware of that stress. But there are conditions and times when we're not aware of the stress that our body is under. Even though you can be a very smart person and a very aware person, there are things that happen in our bodies that are out of our awareness that we're not always aware of. So sometimes when a doctor says, I think you're under stress, and you're not, then it makes you feel like, well, the doctor doesn't really know what they're talking about. I'm not under stress. I'm really relaxed right now. But there can be stress that you're not aware of. And that's where working with a mental health professional sometimes can be helpful to get in and really take a look at what's underneath.
Mm-hmm.
Thank you. All right, I think those are most of the questions that we had here, all of the questions that I can see that we've had from our participants. So I think we must have about I have about 4 or 5 minutes. So I guess I'd like to leave a couple minutes here for the Epilepsy Foundation to come back on and talk with us. But I want to give a lot of thanks to Kay in particular. We in the epilepsy community really do need people who are aware of how to get help for people with mental health conditions, and you were very helpful tonight in identifying the different programs that you have. Again, you seem like a very busy person to me. Talking to 4,000 people a year that's a lot. So thank you for your work. And Dr. Das, thank you for your clear presentation this evening and discussion of these very important issues for people. And I'm going to turn this over to Nikki Baker from the Epilepsy Foundation. Thank you for everyone tonight for participating.
Thank you, Dr. Heck. I, again, just want to reiterate how grateful we are as an organization that we have such great support systems for us to better serve people impacted by epilepsy, and mental and emotional health is a key factor in treating the whole a person, not just the physical aspects or the seizures themselves. So thank you all for that. And I would like to remind everyone here today that we do host connect groups every month in order to help support each other. It's an easy way to meet others impacted by seizures and epilepsy, so they do not feel alone in their journey. We have many different groups based on your relationship to epilepsy, including Parent Connect, Teen Connect, Adult Connect, etc. So please visit our website to see what groups are coming up here. I would also like to thank everyone who did submit questions. If we did not get to your question, or you think of one after this ends, please email us at admin@efmn.org, and we will work on answering all of the follow-up questions you may have. I just want to thank everyone again for your time, and have a wonderful evening. Thank you.